Health benefits. They're a headache, whether you're an employer or an employee. Out-of-pocket costs, deductibles, copays, each another reason to avoid going to the doctor. But why does it have to be this way? At Gravie, we don't think it does. We're reimagining the employer-sponsored health benefits market, showing how small and mid-sized businesses can punch above their weight with benefits plans employees will want to use. We even think they'll love them. On It's a Gravy Thing, we'll explore existing and upcoming innovations in the health benefits space, improving the ways small and mid-sized businesses provide affordable healthcare coverage to their employees. We'll hear from experts on what works, what doesn't, and what changes they'd like to see. MSK. 3 letters that have fast been on the rise in the benefit space. Musculoskeletal issues have risen over the past few years, becoming a top claim driver alongside prescription drug costs. But even as the number of people seeking MSK care rises, patient satisfaction and outcomes have not. For patients, navigating swaths of doctors' offices and appointments can not only be a hassle, it can be confusing. And that's where creative plan design can come in. Pairing patients with expert clinical navigators can alleviate the stress of keeping visits straight and help meet patients' needs through things like finding alternatives to surgery or non-pharmaceutical ways to manage pain. To help explain what this new landscape looks like, I'm joined by Jessica Hennessey, Senior Vice President of Clinical Programs at Gravie. And I'm also joined by Evelyn Chojnacki, Senior Director of Health Plan Product Strategy at Sword Health. These two are the ideal experts to shine light on how health plans can be the catalyst for more patient-friendly, outcomes-driven solutions. So with that, let's get to it. Well, hi, Jessica. Hi, Evelyn. How are you?
Fantastic. Good. How are you?
Thank you so much for joining us for this conversation. I know we were just chit-chatting a little bit about our travels in, and today's a chance for us to talk about something that I know both of you spend a lot of your time doing in your professional hours, and something that I think a lot of our listeners care a lot about, but don't know as much about. So today we're going to be talking about what those of us in the industry kind of in shorthand say MSK care, and no one knows what that means. And I'm talking, of course, about musculoskeletal care, so treatment of pain in bones, hips, joints. And, I think a lot of our listeners know that that's become a huge source of expense for employers, for the healthcare system. And so, Jessica, I think I'll start with you. What has been your experience observing the rise in MSK trend over the last several years? You spent your career in health plans and supporting health systems and health plans around clinical programming. So I'm sure this is something that you've observed over time.
Absolutely. Musculoskeletal conditions affect every age group. And so when you're insuring a population that's got quite a bit of variety from an age perspective, you think musculoskeletal conditions affect everything from pediatrics all the way to geriatrics. So you're covering a broad population that's possibly in pain. We've gotten much better at the diagnostics. So we've got better imaging to diagnose things earlier. And so it does, have higher utilization than most other conditions that may affect a few. So this affects the masses and in every age group.
And is the imaging a big part of the expense increase, that when you have an MSK situation, you're likely getting some form of imaging, whether it's a simple x-ray or even, further into MRI. So these are expensive interactions too.
Absolutely. So you're seeing specialty care and you're receiving special diagnostic imaging. Then you're having potential interventions to prevent pain and progression, and then potential surgery. So we're talking from a longitudinal perspective, quite a bit of expense over a long period of time.
And what is it like for the patient, for the member? I mean, what's unique about being an insured person with an MSK situation versus some other kind of medical interaction?
I think for patients, the biggest struggle is understanding their diagnosis, understanding that there are multiple treatment options, that there's not a single treatment option, that lifestyle definitely plays a part in musculoskeletal disease processes, and that their own health status will also impact their ability to recover. from something, that they're facing. So for patients, that's a lot of options and a lot of choices and a lot of unknowns. So that's the biggest challenge, I think, for them to figure out which path is the right path for me.
And Evelyn, do you find that in your work with health plans that people put off seeking care at first? They're concerned, I tore my meniscus and I'm going to need surgery, or, I don't want to have that hip replacement, but I'm thinking that's going to be the eventual. I mean, to what degree are patients avoiding treatment and care because of the scariness, the maze that Jessica talked about too?
I mean, I definitely think that they are putting it off. I think that there's also an element there that understanding that a nag, something happening within your body is a nag until it becomes an incident, and then you're seeking care for pain relief, for to understand what is going on. And really, I think convenience comes into play. We're moving very quickly in our lives, and just being able to take time to stop and understand and pay attention to your body. And I also think historically, from a treatment pathway perspective, at least I felt this way as a patient, and just also working in health insurance, is that there was always this impression that you have to go to the doctor to get a prescription for physical therapy for additional support, when in fact you could actually go directly to physical therapy in most states now. So I think there's several elements, and I think overall health literacy is often a challenge too. Understanding where do you go for the support, and how do you get the best information for the most effective and efficient pathway.
And so you're here from Sword Health, and obviously Sword is a leading digital health company in the MSK space. So talk a little bit about that, the convenience piece. I mean, we've seen a big emergence of digital health companies in all areas of healthcare, but particularly in the MSK space. And, some of the old guard, have kind of have had some criticisms of the emerging digital therapies or virtual therapies. I'm curious if you can talk from the perspective of somebody who's, working at a company that is making it easier for patients to get the care they need.
Yeah, I mean, making it easy is certainly top of mind and key when we think about care delivery at Sword. Remaining clinically focused is also top of mind. That's why all of the care that we deliver is a doctor of physical therapy paired with technology to really drive that engagement and utilization component. The majority of our health plan partners as well deploy Sword as a care management solution, as opposed to the tangible benefit. It doesn't apply to your 30 PT, OT speech visit limits that are standard to benefit plans, to make it more accessible upstream to people who need it earlier on. So it's really building that awareness of, does your back hurt in the morning? You can actually address that now, as opposed to waiting until it escalates into something more serious. And so I think that in terms of the perception of digital health, it is really about shifting our mindset to treating health as opposed to delivering care. And we really have to focus on that difference, right? Care is a point in time. It's a point of service interaction between a member and a provider. When we are delivering health, it is really allowing that continuous interaction, building a trusted relationship, having that point of that point in time ability to interact with a therapist to give you guidance and to help promote and help you understand what your best and most effective care should be.
Mm-hmm. And so I imagine at Sword you work with health plans of all different sizes across the nation. What are some of the trends you're seeing? How are health plans designing benefit structures that prioritize some of these virtual services that Sword Health offers?
There's been a significant shift, and we can blame COVID or not. I think it was evolving prior to that to really look at, the fact that what we've been doing to address this issue over and over again isn't working. So how do we create care that is more accessible, that is more convenient to individuals, that doesn't require that you have childcare to get to an appointment, that doesn't require that you have transportation to get to an appointment? And it's really shifting that place of service us from a physical in-office experience to where is it most convenient to you to access care. Interestingly, the majority of our appointments, I think it's over 45%, take place before or after what are considered traditional business hours in clinic settings, and about 70% take place on the weekends.
Wow. So it's funny, as I'm hearing you talk, I'm thinking about accessibility. And we, we think a lot about accessibility being only about cost, right? And at Gravie, we have our Comfort flagship product has built into it, into the, into the product, a partnership with Sword Health, where our members are able to use Sword for virtual physical therapy and other things to address their muscular issues, with zero copay and zero deductible. It costs them nothing additional outside of the, the premiums they pay monthly to get that. So that takes away a little bit of the accessibility barrier. But it's interesting in hearing you talk, it's not even just the way you design the plan. It's, how do I find time to get to the doctor for a nagging elbow pain, which might not feel in the grand scheme of my life like a big thing that I should be focusing on this week. And, I imagine, Jessica, that a lot of the patients that you've seen over your career, if you made it easy for them to get the care, they would get more care.
Absolutely. It's a health equity play, in my opinion. You have people that work third shift, as a nurse, I've worked plenty of third shifts, right? You can't always follow traditional 9 to 5 guidelines with no weekends, which is the brick and mortar model at times. And when you're in a rural area and it takes you a half hour to drive somewhere, and like you said, you have childcare and things like that, it does become a health equity play. And the fact that, Sword facilitates the digital products and the offering by sending what they need as far as, being able to have everything in your possession that you're going to need to complete that physical therapy session it's really pretty amazing.
Yeah, it's so funny. I mean, I hadn't really thought about it as a health equity play, but it makes total sense. And so what kinds of employers should really be paying attention to, virtual care programs for MSK? I guess employers in rural markets, employers who have like gig workforces, right, who are working shifts.
Yeah, I mean, it really can benefit anyone. I have my own experience with my own daughter who's a minor. They're really busy and rehabbing, and they're used to digital interventions much more than I think, the older population. And to them, it's like second nature.
Yeah.
And to me, one of the things that I would say is most advantageous for employers is they have to think about their population. Ergonomics at work sometimes are making things harder, for members. So to offer something that's going to counter, that in their setting, is perhaps a great investment for employers to consider.
Yeah. And, do you think, Evelyn, that employers are starting to really pay attention to what's driving their costs each year as they go back and meet with their benefits consultants and start looking at what should we be doing this year based on how our plan performed last year? Is MSK becoming something that they're starting to shine a light on?
So honestly, I would say it has remained a top 3 cost driver for at least 20 years, at least since the time that I was on the health plan side myself. Business Group on Health put out a survey of large employers this year. It is still among top 2. The only one above it is neoplasms or cancer, which is, so if you look at those two combined or separately, MSK is the one that you can truly impact. I think that they are looking at it and they are understanding that our workforce now looks differently, as it looks different than what it previously did. So how do we meet people where they are? In addition to, servicing those in rural areas, when an individual is enrolling at Sword and they indicate they do not have access to Wi-Fi, we will issue them a hotspot with their kit to make sure we're enabling that access.
Well, it's interesting because I think but you mentioned COVID, I think, programs like this kind of the impetus for them was around telemedicine and bringing care to people in rural areas in particular. But the value of these programs that health plans are running right now, whether it's virtual digital care or just a benefit design that provides better cost structure for MSK treatment, that seems to be emerging as a must-have in a health plan these days. Whereas before, it was a nice to have if you could do something that expanded the reach to different populations. It almost feels like table stakes now.
I think it is. Yeah. It absolutely is. And, what COVID did teach us about these elective procedures is that postponing, which a lot of elective procedures were postponed over, millions of procedures were postponed. Hundreds and thousands of dollars were lost by hospitals due to, their budgets depending on these elective procedures. What that taught us is that, we really need to make this available to all, right? Because postponing those surgeries didn't bring harm. In fact, they found other means to do it through these digital products, and then ended up potentially negating having to need surgery and avoiding surgery or picking less invasive procedures. So that we've learned a lot of lessons from having to not have access to those surgeries during COVID and what it did longitudinally for those patients and their outcomes.
Mm. Well, and I imagine that there's some programs that look better than others. So if, you're a benefits consultant or an employer and you're starting to evaluate options, what are the things that you think either of you should be looking for when it comes to MSK coverage at a health plan?
I would say from the perspective that I sit in, it's significant for those evaluating it that there are proven cost savings associated with it. So you want to make sure you're getting your ROI. There are two different elements, right? There's VOI, which is value on investment. That's the bells and whistles of some of the solutions that are out there. But from an MSK perspective, knowing that it's a top 2 cost driver to the plans, you want to really have a sense that the solution is clinically validated and that you're able to drive that ROI back to the plan or back to your, respective clients and groups.
And so how are employers seeing that ROI? What are they seeing as an ROI on these kinds of programs?
With SWORD, they're seeing a reduction in cost. On average, we're saving $2,500 per year, per enrolled participant per year. And so, that's one element.
Say again, you're saving
$2,500. So you're getting at least a 1.5 to 1 ROI back from the investment in deploying SWORD to your employees. You're also seeing improved productivity. So you're going to get that element of it as well. And then there's that direct interrelationship between physical and mental health. So with all of our participants, we see an improvement of over 50% in both their anxiety and depression scores as measured by PHQ-9 and GAD-7.
And that goes a lot to say with when you decrease pain, right? Mm-hmm. People don't want to be in pain.
Right.
And I think, improving people's function and ability to have that mobility without pain is very important. So I agree that the mental health component is an added benefit. I also think employers need to consider peripheral coverage with acupuncture, massage, like gym, benefits, things like that are going to support that sort of healthy movement, nutrition support for weight loss, because as we know, there's a correlation between the pressure on each of the joints and obesity. So the employers have a lot to consider when they're looking holistically at MSK, not just a virtual solution, but how do you wrap all the benefits around that's going to support that lifestyle change.
Yeah. And I imagine it's not a one-size-fits-all approach. Does the market need more solutions that meet the needs of more employers when it comes to MSK?
There's definitely a lot of point solutions already out there, but I think it's the way that the market is going to go. Consumers are demanding more convenient access that's going to work for them, that's have proven results, that are driven by evidence-based medicine, so that they don't have to sort through the maze of is this evidence-based? Is this experimental? Is this one doctor, as we know, not all doctors are created equal, and why, again, second opinions and things like that become really important. So as long as you have a validated program that's evidence-based, that's got good outcomes for members, I think that's a good place to start. But
I would add to that. I'm sure that there will continue to be more, and that throughout those experiences, those that are really shown to provide value and that member delight in terms of experience will rise to the top. I do want to make a clarification that even with the availability and deployment of SWORD, we're not in the market to totally replace the need for traditional physical therapy, but by addressing upstream needs before they do escalate and become more critical, that does allow for the accessibility and availability of more real-time appointments with those in-person physical therapists. Some individuals will still need in-person manual treatment. So that I think that's important to clarify that, because, we often, at times there's a sentiment about, disrupting provider networks or disrupting existing provider practices. And there's really enough MSK to go around for everyone.
Everybody, yeah.
Yeah. So it's really more of how do we all play a part in supporting individuals.
Well, and I'm so glad you mentioned that, because not just for the reason you mentioned it, but, there is this maze of that a person must navigate whenever that comes to any healthcare interaction. We all know that, but even more so perhaps with MSK, because as you mentioned, there's all different ways you could go about this. You could go the virtual route. You could go the route by starting with your PCP and getting a referral to an orthopedic specialist. There's, there's second opinions. There's people who will tell you you could Google, Dr. Google, and tell you what to do. So Jessica, I imagine, I know that you and I have been talking about the emergence of new clinical navigation programs in different disease states, but with MSK being one. I know at Gravie, for instance, we're preparing to launch a clinical navigation program specifically for our members with MSK claims, because we know that there is a lot of them, right? So how do you, as you set about to create a program that, to Evelyn's point, helps people get the care they want in the way they want it and where they want it, how do you set about to paint that picture in a way that doesn't feel like a maze, but instead feels like a series of decisions that are well informed?
It's absolutely critical in a navigation program to be able to take individuals' goals, because what's important to one person may not be, not everybody wants to go out and run a marathon. That's not their goal. Somebody might want just more mobility, less pain. So taking into account what is it that is their personalized goals, and then being able to create a care plan that's specific and unique to them, that takes the whole person into account. Not just, they're not a function of their one condition, but like, how does this impact their life? If you have a total knee replacement and you work kneeling down, how is that going to impact you? If you can't kneel down at church because you have a religious belief, how will that impact you? So it's not just looking at the actual joint and what's best for that particular pain or joint, but it's looking at the member holistically to say, how do we navigate you through what you want to achieve in the least invasive manner possible that's going to be the most effective?
So how does the health plan do that? Where do you start? Is it with a unique set of nurse navigators? It sounds like you're talking about a very personalized approach, which makes a lot of sense to me as a person who has a health insurance membership card. So where do you start with that? You
start by not looking at each individual as population health. Traditionally, health plans have looked at cohorts together. These are my diabetics. These are my musculoskeletal patients. And so we want to break that mold at Gravie. We want each member to be unique and each member to be able to interact with the nurse and verbalize what it is that they need out of the program and what they want, and then have the nurse be able to educate where there's gaps. Because there might be knowledge gaps where a member doesn't know about a particular treatment option, and they may not know that something might be experimental, but it's being recommended. And they take the physician's word, and when in fact it's not in the literature. So I think, our job is going to be to educate patients, but the most important thing is going to be the empathy and the listening skills from that nurse navigator to make that experience unique.
Well, and I wonder if there's something to it that, oftentimes an MSK ailment is invisible to other people. Unless someone's wearing a brace or walking with a cane, it almost feels like it's often an invisible pain. Right. So I imagine that empathy is particularly important, because if you're living with back pain every single day of your life and you're working as well, and you don't want to show that pain at work, that's a big burden to carry. And, I think I understand what you're both saying when it comes to that mental health aspect. It's not just about fix this pain. It's like, how do I live with this pain? How do I go about my life with this pain?
I think you also, in that, scenario, you also have individuals who have multiple types of pain that they're dealing with. So a navigator solution like that, I think, is amazing, because it also helps them prioritize what they can address first. How can they address something first, and how can they prioritize? Because if you have comorbidities, right, there are some things that are going to be harder to resolve, and then there are some things that are going to bring healing to broad categories of that individual's condition. And I also think, from SOAR's perspective, I love the idea of the navigator. We've got about 2% of the population that enroll in SWORD may screen a red flag in terms of their onboarding experience with a doctor of physical therapy. And having a place for that individual to land for further care and further guidance is really going to be an amazing kind of synergy between those solutions.
Well, you and I were talking earlier, Evan, before we started recording this podcast about, the reality is with MSK, it's not a one-off appointment. It's usually a series of, it's a journey.
It is.
Right? Because there's an outcome that you desire, and that outcome is either pain reduction or avoidance of surgery most often. So, it's
the idea of having that navigator really helping you chart that path and understand what your journey could look like and align to your personal, needs and desires is really.
So I guess it would be fair to say that employers should not just be looking at, oh, wait, does that plan have an MSK benefit, meaning the copays will be low or non-existent? It's about looking at what the program is, at the support that the program offers, at the, what does, as you mentioned earlier, what is the ROI? And if I'm an employer, I'm looking at it from a financial perspective, both hard dollars and lost wages and, employees who are out sick. So what does good look like?
That's a great question. I mean, I would say good looks like understanding the patient needs, making sure they understand their diagnosis, all their treatment options, putting them in the right path of care, both from a facility standpoint and a physician standpoint of who is, best equipped to get their care, and then coping and support. Right? Sometimes surgery is the right answer. Mm-hmm. It's not always about surgery avoidance. Yeah. And so good means if you need surgery, then we need to optimize your health before surgery and after surgery. So it's
really, make sure you go to the right surgeon.
Exactly.
And that you know what questions to ask.
Exactly. So doing all that preparation to ensure that that patient feels confident with their decision, and then is put into the best hands for the best possible outcomes. I think that's what good looks like.
Well, so let's talk about the elephant in the room, which is that a lot of people feel like their health plan is really just interested in saving money, not in helping them. And I think there are probably many physicians who would say things that might support that from their patients. So how do you convince a population that might be a little bit suspect of your motives to participate in something that we really believe will help them, not just save money, but help meet their need?
I mean, sometimes it's about spending the money that you need up front to prevent, that surgery. So I don't think it's about, I think as a health plan, at least for Gravie, it is not just about saving dollars. It's about doing the right thing for the member. So members might be suspect because they're used to traditional health plans where everything is like a block and tackle and saying like, no, you need prior authorization for this, or no, this isn't covered, or no. And at Gravie, we're trying to take a different approach and say, we feel this is what you need and this is how best to get it. And if you need surgery and that surgery should be covered, let's put you in the best hands. So it's not about, like I said, the blocking and tackling to prevent patients from accessing, which is more of a traditional health plan.
Well, and you had mentioned point solutions earlier today. And, tell me if this makes sense. The way I'm thinking about it is that a lot of health plans will partner with a digital health company as a point solution, which, if not done correctly, does contribute to that get prior auths, get pre-certification, walk this maze. I know at Gravie, we look at the comfort plan as the chassis to a full range of benefits, not access to a point solution that lives on its own. I mean, if you go on the Gravie app, you can get to the SWORD portal straight from your app. You can use your Gravie membership to enroll in a program. Is that becoming more common, Evelyn? And I imagine, is it becoming more common? And also, would you agree, and to what degree, that the ways in which a carrier partners with a quote unquote point solution really matters?
Yeah, I think going back to the question of what is good is definitely comes back to the partnership and the relationship, right? The connected ecosystem. What does that individual have at their access, at their fingertips to round out their care experience? And I experienced that too on the health plan side. It isn't just truly about paying claims. It is about taking care of that population. It's in everyone's best interest that we do that. And so when we think about, what is the outcome? Well, it's frictionless experience. So making sure that individuals know where they need to go when they need to go, and what do they have access to. And it's unfortunate too, because I think a lot of times we don't, even as informed health users, like we don't know what we need until we need it, and then we're not quite sure where to get it. So I think we all do have it as part of our responsibility is educating in advance of what you have available to you for these instances. I think I may have taken the answer to the question out to the left field, but I think it's really about the partnerships and understanding kind of how do we all work together? How do we make sure this ecosystem is that holistic care experience?
Yeah, and Jessica, as I guess let's talk for a couple minutes about the program that I referenced that you're building. What are some of the tenets of Gravie's soon-to-be launched clinical navigation for MSK program?
I mean, we've got a multitude of interventions that we can put into play depending on, what the member goals are, SWORD being one of them. But we, redirection of care, saving dollars if you're seeing an out-of-network provider, finding you an in-network provider. Like I said, chiropractic care, pain management, decrease in opioid utilization. So we're looking at this very holistically to not just, it's not just a single partnership. It's a multitude of interventions that are available in that, bucket for the patient to kind of select. And what should come first is where the nurse navigator is going to guide. Okay, you're in a lot of pain. We're going to work on pain management because you can't think straight when you're in pain. You can't go to work when you're in pain. You overutilize opioids when you're in pain. So it might be, for one member, they might tackle that first. Mm-hmm. For another member, it might be, no, I really think you should have some preventative stuff. You're sort of in the aches and pains kind of, you need some increased mobility and functionality of that joint. Let's get you into SWORD. So every member is going to take a different pathway. There's not a cookie cutter approach to how each member would walk that path. And so that's our hope, is to use that multiple bucket of interventions and create a unique care plan for that member.
And all the things you just described, if you're a Gravie member, that's included in your health plan. You can get that support from a nurse. You can have someone help you find a second opinion. You can help somebody help you understand the different treatment options available, find that specialist, all of those things.
Yep, absolutely. And provide the educational content and the health literacy needed to make those decisions.
Yeah, no, that's super important. And is that common, Evelyn, with most health plans? Are most carriers taking as proactive an approach?
Yeah, I think they go either one of two directions. Either they're partnering with someone to help with that care navigation component, that digital front door, the guidance, or they're building it in-house. We are seeing that quite broadly, but I think the way that Gravie is bundling it together as an inclusive offering for those participants is different. I would consider Gravie more of a next gen, if you will, in terms of health plan mindsets.
And how so?
Just taking a very forward-thinking approach to getting ahead of, the care experience for individuals. I think when we were early in the partnership, we talked a lot about the healthy well. And so really understanding that individuals coming into benefits don't understand benefits till they need them. And so being more proactive and saying, okay, we include all of these elements, it creates a stickiness factor too, right? And that's membership. Growing your membership is critical to any health plan, but also to Gravie. And so it creates that stickiness factor. It creates a sense that my health plan actually cares about me, and that's a cultural shift too. It's not a combative experience, right?
Yeah, that goes back to what I was referencing earlier. Is I think historically there's just there's a distrust. There is, and it seems like in the MSK space, there's health plans are really trying to do the right thing by patients. That just so happens to also be the right thing for employers.
I think too. I think that there's this. We still have this challenge of overcoming that individuals who are ailing, that have a disability, they're in pain, think a surgery will fix something, right? We still want to fix things that are not right. I don't want to say broken, because the broken bone's a different situation.
Maybe it might be a sprain.
But it is a sense of, getting ahead and doing the work as an individual, because, 58% of spine surgeries should not occur.
What do you mean? 58% of spine surgeries should not occur? Say more.
So that's a quote in a study by our Chief Medical Officer, Dr. Vijay Yanamandala, a neurospine surgeon up at Hartford, doing a study of spine surgeries. It's an invasive procedure to address an ailment that is, in most cases, better addressed with physical therapy.
Okay.
Less invasive care, because many of those spine surgeries occur and it actually creates more problems down the road for the individual as opposed to fixing the problem. And so, I mean, I know that you said, Jessica, some surgeries are necessary, but several are not. And I think we have to change the mindset that when you walk into a surgeon's office, their business is to do surgery. Again, not attacking the surgeons, but we've got to change.
They're not there to ask questions to really
and tell you to go away.
Right. They assume you came there because you need surgery.
Correct.
But maybe someone didn't tell you don't.
Correct.
And I mean, as a nurse practitioner, I've seen this, and the ongoing joke was like, once you're a spine patient, you're always a spine patient because, you cause a fusion. You've just taken a, mobile spine and immobilized it, and now you have a mobility above and beyond that point where you immobilized it. You're setting yourself up for future surgeries and so forth.
More claims for the employer down the road, too.
So a lot of the times, spine patients come out and they say, well, I didn't get better after surgery. And it's true. About 50% of patients or so, they don't necessarily improve the symptoms that they went in to improve. So they continue symptoms and now have exposure to future surgeries as a result of that spine surgery.
Yeah, and those are the patients that are adherent to the treatment plan. What about the patients that aren't? We talk a lot about medication adherence. And I'm thinking about that because, as a top claim driver, a big part of that is also that then people don't adhere to their medication regimens. And we all have seen the data on the hundreds of billions of dollars that are lost to non-adherence. What about adherence to an MSK treatment plan, through clinical navigation, through a virtual healthcare provider, through others, What would you say to those who would argue, well, at least if this person's going to the doctor's office, they're going to see their orthopedist, that they're adhering in some way? How do you get a person who might be willing to speak to a nurse navigator to actually take the steps needed to do the work? I mean, physical therapy, if physical therapy is required, that is a burden. We talked about before work, after work. If you have to find 20 minutes in your day to do your exercises, to do the stretching the doctor wants you to do. So how do you look at adherence when it comes to MSK?
I mean, I think it's important to understand that patient motivating factors, what's going to motivate them to make those decisions and get better. And so all of our nurses are trained in motivational interviewing to be able to sort of hand select the things of like, oh, you want to be able to lift your grandchild without being in pain. And, that's a goal that you might want to have. So really putting it into reality versus, you need to take your medication every day, or you need to, do your physical therapy exercises. It's really finding the motivational outcomes that they were looking for and tying those to that path. So to me, that's a critical role for the nurse to do.
It's getting underneath the hood a little bit. And it goes back to that mental health piece. Evelyn, what would you argue?
So, I mean, we've all experienced that instance where you do go to physical therapy and they give you the PDF printout of your exercises and you go home and you're supposed to do those 3 days a week. And honestly, I can't tell if I'm supposed to slide my leg out to the right or bring it out forward because I'm looking at a PDF image or a printout. At SWORD, adherence is, at enrollment, individuals can select the physical therapist that they want to work with, that they relate to most based on that individual's lifestyle, behaviors, personal preferences. Once they have the consultation with their physical therapist, they create that a one-on-one relationship with that therapist. And our therapist even will say at SWORD that they actually have deeper relationships with their patients than they did when they were in clinic and in practice. Because in clinic, they're bouncing around from 3 different patients at the same time and just going through their workload for that day. And the therapist at SWORD, they do have an understanding. What are your personal goals? You want to walk your daughter down the aisle at the wedding? And so they're going to keep that top of mind, and they keep that continuous conversation going with the member. They see every time you complete your care plan because the digital tablet or digital therapist sends that information back. It shows where you're erring out in your movements, and it gives that therapist a sense of how are you progressing? Where are you struggling? Do you need to have some adjustments made to your care plan?
Yep.
And so it's that real-time engagement and interaction and trust in that relationship with the therapist that really drives engagement and adherence. We're averaging 83% care plan adherence, and that means completing at least 9 sessions. We know, historically, and the evidence suggests that individuals, typically 70% will drop out after 3 sessions going in person. And who's to say that they're doing those exercises at home?
Or doing them correctly.
Right.
Yeah. Interesting. Well, I think there's so much for us to explore in this. I imagine we'll continue to talk about this. I mean, the trend isn't going away in the claims, at least. I guess in closing, if you got the chance to meet with 50 employers and, talk about what they should be thinking about, what questions they should be asking, what should they be looking for when it comes to developing programs as part of their health benefits plans that really support and meet their members' needs as it relates to MSK. If you had a couple minutes, what would you tell them?
I would say it has to be comprehensive and very cohesive. Just bringing a bunch of point solutions that are disjointed with nothing to bring that connectedness together is almost futile. Because you don't want these point solutions operating in silos.
Yeah.
The partnership we've had with SWORD, we exchange information about patients. We get lists of, we know who's enrolled, so we're not going to suggest someone to enroll in SWORD if we already know that they've enrolled. Mm-hmm. If they've dropped out, we're going to know that information. So I think bringing, your pharmacy benefits together, your supplemental benefits, like I said, chiropractic, acupuncture, pain management, those kind of things, bringing the nurse navigation together and point solutions that are going to be convenient for patients to use and easy to use and diminish access issues. I think that's the way to go.
There's so many pieces here. I think it would just be that, that the landscape that we've operated in for so long has changed. We know that we are dealing with an issue of provider shortages in those traditional brick and mortar clinics. We're dealing with health equity issues when it comes to access to care and understanding that there are significant disparities in care. And so recognizing that a one or two benefit plan option kind of solution doesn't meet the needs of all of your employees, that your employees have stories that reside outside of the workplace and outside of those claims instances, that we need to really think about how do we diversify and offer a very dynamic approach to benefits to meet people where they are, and take it, a holistic view there. There's elements of cost that we can talk about, but that is very, quantitative, right? When in fact, we're all individuals who are trying to just lead the best possible and healthiest life we can. And so understanding how, those unique individuals and their needs is critical.
Yeah, and I think the data show that if you approach treatment the way that we're talking about, that the ROI proves out to be there as well. Perhaps even MSK is an area where health plans have an opportunity to really build some trust among their membership, among employers, to that point where they can see that this is good for us all. Like you're going to feel better. You're going to get better care and better guidance. And at the end of the day, maybe you'll see a decrease in spend for your group, the sharper the interventions get. So a lot of opportunity. I love it. I've worked in health plans for a long time, as you both have, and it's fun. It seems like a weird word, but it's fun to see when, something that's so universal, we've all had pain, with our bodies, and it's something that's so universal and that should be so simple. Like, let's take away all of the complexity of it and just make it work better, do it right so that people are helped and that we can, this is a problem that seems solvable. There are some problems that just aren't, and this feels very solvable. So thanks to you both for being with me today. Thanks for the work you're doing on behalf of Gravie, on behalf of SWORD Health, and, on behalf of MSK patients everywhere. Great to have you both here today.
Thanks, Jeff.
Thank you.
I really enjoyed that conversation on musculoskeletal therapy and how different health plans are starting to get innovative with their approaches to helping patients manage that. Our thanks to both Jessica and Evelyn for joining us on this episode of It's a Gravy Thing. If you'd like to learn more, head to gravy.com. It's a Gravy Thing is produced by Gravie in partnership with Pod People. Thanks so much for listening. And if you liked what you heard, rate and review the show. And of course, subscribe to It's a Gravy Thing to make sure you never miss out on a new episode.